my video presentation accompanying my September-October issue of the LinkedIn newsletter, The Biomedical Artist, which focuses on the precious role of art, namely ballet, dancing, music, in mandalas, in painting, in prevention and treatment of Alzheimer's, dementia, and other mental illnesses. This was not planned. This came about when I shared yesterday the first part of the video, which only focuses on the benefits and values of art in these conditions. And often, like yesterday, when I shared this viewpoint, or when I share my ballets for health and happiness and highlight their value in managing stress, in alleviation of anxiety, depression, in stimulation of learning and memory, in enhancing of cognitive function, in improving of sleep, people comment, they give me advice that now there are the magic mushroom, psilocybin, and they share their opinion that they are very valuable for treatment of depression and anxiety. And I wanted to say that art therapy does not exclude medications. Art therapy is part of the complex therapy which includes medications and psychotherapy and lifestyle changes. I would say that art therapy is in large part psychotherapy and lifestyle changes. And in my opinion, art therapy is a lot safer because art therapy exists since ancient times, since Egyptians, ancient Asia. We can see the drawings and the songs and the dances in the Hindu culture, and they have helped people express their emotions, regulate their emotions, and deal with issues in their life and create something beautiful and have survived the test of time. Now people are developing medications for the treatment of neurologic and psychiatric disorders based on the advances in medicine and the knowledge. However, my dad is a pharmacologist, and since a young girl and later being a medical doctor myself, I learned that every medication, besides positive effects, has side effects. And to take psilocybin, for example, personally, I have not treated patients. From what I read, it is effective and it is administered together with psychotherapy. It is effective in anxiety, depression, PTSD, and this is wonderful. However, I read an article in JAMA Psychiatry, Journal of the American Medical Association, based on the analysis of 6 clinical trials with over 530 patients, that psilocybin causes acute side effects, namely nausea, headache, anxiety. When it is used for treatment of anxiety, dizziness and fluctuations in blood pressure, which resolve usually within the first 48 hours, but the long-term efficacy and safety has not yet been determined. I also read another report that being an agonist at the serotonin H2A receptors, psilocybin at therapeutic doses used for microdosing has induced a serotonin syndrome in a 35-year-old woman. And serotonin syndrome is something which could be life-threatening when the levels of serotonin increase, flushing, rapid heart rate, very high blood pressure, muscle spasms, and she was treated and she recovered, but it is something very serious because psilocybin acts through serotonin receptors just like some other medications for depression do. And since we're talking about depression, there are many treatments. Psychedelics, there are serotonin reuptake inhibitors, other medications, there is transcranial magnetic stimulation, there is ketamine or ECT. My grandmother had depression and none of the medications nor ECT helped her. And I have read articles about a woman who was in very debilitating depression. She just had no motivation about anything. I think I read in the New York Times. And one day she woke up and started taking pictures around her. And this made her notice the world in beauty, and with taking many pictures, she started gradually improving her mood and noticing the beauty around her. So this is the danger of medications, that they might have side effects, whereas the side effects of art are minimal. I would say with painting or with music, virtually no side effects. Dancing, personally I prefer ballet dancing. This is my favorite style. Sometimes you might have sore muscles, but if you dance gradually and if you are not experienced with an instructor, you will feel wonderful with no side effects. And I have made another video several months ago, which I will include towards the end of the video, that actually dance and other forms of art therapy activate the same neurons that and neural networks that pharmacological drugs do. And actually, they cause the release of neurotransmitters such as dopamine or opioids, endorphins, and perhaps serotonin. And this is how they act, because for the neurons to function normally, the same changes occur either with medications or with art therapy. Of course, therapy is something individual, and each person has to discuss with their physician, therapist based on their situation. And it is a matter of personal preference, but it's good to know about all methods and make a choice. And art is something enjoyable. If you practice art, you can paint a beautiful mandala, or you can dance a beautiful dance, and you feel a sense of accomplishment and create something beautiful. What if you don't like ballet? There is ballroom dancing. You can do belly dancing, or you can try Zumba dancing. I have tried all of these dances, but I prefer ballet and classical music. Another example, my mom is also a physician, and she used to take a lot of medications for high blood pressure because she had high blood pressure since a long time, for weight gain, medications for weight loss, for anxiety, for difficulty sleeping, and ultimately her gallbladder and her liver suffered, and she still passed away from a heart attack in her 70s. And if she had made earlier changes in her lifestyle and include more dance and perhaps more control, weight control, maybe her health would have been better. And I remember my mom had a whole bag of medications. Some people like myself are allergic. I do not take any medications except sometimes some non-steroidal anti-inflammatory medications. I'm allergic to antibiotics, and if I have anxiety, I like to dance or to paint. And so I would like to say that art therapy is a complementary therapy to the pharmacological therapies, and it is a matter of personal choice. It is something that has survived thousands of years. It is something beautiful, and I would highly recommend it. Thank you for your time and attention. Be well.